Welcome everybody to episode 2 of Clinically Correlate with Azfar and Vedant. In this episode, we'll be talking about the best prelim year to do before radiology. So we'll just start off. We have a couple questions kind of lined up. Azfar, can you tell us a little bit about like the different types of prelim years that people can do?
Yeah. So you can divide it into 3 types, but I think you can go into further divisions. So let's just rattle it off, right? First is the prelim medicine year.
Yep.
And then you can do that at a community hospital or at a university hospital. Then there's the prelim surgical years that you can also do at a community and a university hospital. And I think the experience definitely varies between those two, more significantly than a prelim medicine year at a community versus a university hospital. And then, of course, the very best transitional years. And those can also vary by mileage.
Yeah, so that was a great kind of description of the 3 main different types of programs. I think kind of going to the next level of detail, there's really 3 or 4 different parameters to keep in mind when you're choosing a prelim program. One would be location, 2 would be complexity of the pathology, and then 3 would be work-life balance. In terms of location, a couple of options. One is definitely like the home institution where you're doing medical school. 1 would be the institution you end up doing your actual radiology residency. And then 3 would be a kind of like a mix between either you want a place that's like close to family, close to like an area in the country you want to live in for a year, or just some kind of miscellaneous reason for your own kind of specific life reason.
Yeah. And then I think, as you said, the complexity of pathology, I think you have to realize, doing a very rigorous intern year, like whether it's surgical, even sometimes TY, or medicine year in a big city, in a big university hospital, will give you access to many different complex pathologies that you may not necessarily get at a small community transitional year program. Whether that's meaningful, necessary or not, we'll kind of delve deeper into it further into the episode. And lastly, as you said, work-life balance. A surgical year, or even a prelim medicine year at a big university hospital may not give you access to a number of electives, can have a bigger clinical requirement than a smaller transitional year program.
Yeah.
And now let's kind of delve deeper into our own experiences.
Yeah,
because
100%.
You did a surgical intern year at a university hospital, a big university hospital. I did a transitional year at a much smaller community hospital, right?
Yeah.
And we both did this at places that, we didn't both do this in Philadelphia. We both did this in different places. Mm-hmm. What was your experience in your intern year?
Yeah, so I did my surgical year at the University of South Florida in Tampa. Mm-hmm. Ended up living at home. Kind of the thought process there was my fiance at the time, now wife, she matched in February in urology. Mm-hmm. And then 3 days later, found out I didn't have any prelim interviews in Philly. So I was like, well, if I can't go to Philadelphia, might as well go back home for a year. Mm-hmm. And then had my USF interview 5 days later. Mm-hmm. And I was like, I 100% want to come there for a very specific reason. Right. And so there wasn't the parameters we just talked about. It was a very simple decision-making tree for me. Put all my energy on where I want to do my radiology residency and not so much thought on my prelim year. But in terms of that surgical experience, definitely tough. Props to surgical residents. They do this for 5 years at a minimum, right? And it's a day in and day out grind. Only a certain point, you can't feel more tired when you're so exhausted.
That's right.
You will hit that point after 4 months, and you kind of stay there for the next 8.
Wow.
So it's about surviving, which is not a great way to live, but at least it's fine, I guess, for a year.
Yeah.
Or I have Stockholm Syndrome. I don't know. But I do think from a learning standpoint, I want to do IR. I'm doing IR, so IR isn't here. But there's 2 things I think. One is even diagnostic radiology, in my opinion, is the bridge between medicine and surgery. A lot of things can be solved by understanding the history, physical, and labs. And then if it's an anatomical problem, then it ends up going to surgery. So one, you see those patients that you're kind of at that crux of the decision-making process a lot of the times. And then 2, I think, the peri-procedural management is something that as a medical student, you kind of learn just a little bit as a surgical medical student, but I think you fully really understood once you've done an intern year. And then in the context of IR, now you're when you are doing those procedures, if there's complication, you have an idea of exactly how to manage it. And I think from an IR perspective too, our complex cases come from our surgical colleagues.
Yeah,
Whether
yeah.
it's, post-op cases that they need help on draining an abscess,
Yeah.
or understanding why some patients aren't surgical candidates and where our procedures can really be a benefit to them.
Right. So I think you hit on two very important points there. In terms of benefits to radiology residents of doing a surgical year, number one is most departments are dependent on radiology to a certain extent, but in surgery, right? In order for us to kind of understand the pathologies better, to understand complex surgical patients better, it's useful to go through a surgical residency just to understand the nuts and bolts of the surgery, right? And currently I'm in my cardiovascular rotation, and boy, I think so many times it's the different graft types, where the anastomosis are, where the fenestrated stents are, where can complications occur, and the lingo that they understand, right? I don't have to say, there's an evolving contrast. I can just say type 2 endoleak, and my surgical colleagues understand that. So kind of knowing that is of huge benefit to radiology residents, right? I went to it's sort of a relaxed transitional year in the same town where I did my medical school in Syracuse.
Yeah.
So there wasn't a big geographical transition for me. But in terms of clinical experience that I received that was directly sort of translated well to my radiology education, I don't know if there was a big sort of payoff in the end, to be very honest with you. Because at the end of the day, there were many services that I did not rotate in, like neurology, cardiology, who also communicate a lot with diagnostic radiology. And I can pick up the clinical sides just fine on my radiology rotations now. Right? Was it nice to kind of know the nuts and bolts of inpatient medicine to be on the other side? Sure, but I don't think it necessarily made a big difference in my radiology kind of education right now. I could pick up what I need to know just fine in my radiology rotations, right? But I think to the other point, right, where a big difference can be made is in procedural experience, right? Tell me about that and especially for someone who is going into interventional radiology. Describe that for me. What was your procedural experience in your surgical intern year? Do you feel like you had a decent amount of procedural experience, or was it mostly kind of managing post-op or pre-op patients?
Yeah, I think that's a really good question. And probably the biggest parameter from a technical standpoint for people choosing a surgical year, because there's so much variation. I think the larger academic programs do end up tending to use interns mainly as like perioperative management and taking call. And especially if they have prelims versus categoricals, even there, oftentimes even if there are opportunities to be in the OR, it's mainly for categorical residents. And so, for my institution, it was kind of like a hybrid mix. But I will say the caveat to that was that they put the prelims in a lot more of like the overnight call pool where we're not in the OR. Or in my case, I spent more time at the VA, which just had like slower volumes compared to like the other hospital. And so I would say, it was not the most procedurally heavy place. I know some of my colleagues probably had a little bit more procedural exposure, but it definitely, I think, gave me what I wanted to know, especially going into IR, which is really, basic suturing skills, getting a chance to do that, closing, and understanding basic surgical technique. And it's so dependent, I think, of who's running the floor. So it's actually very beneficial because some of our rotations were run by nurse practitioners, and it was almost like residents were medical students. We just got to go to the OR and operate. And those were the ones that we really got to improve our surgical technique.
Now, here's a question that many folks will be wondering. Is there a big difference between a community surgical prelim year versus a university surgical prelim year?
I think there's a huge difference, a very widespread. With this community programs, especially if the attendings, surgeons still operate at 7:30, right? They're not, if they're in the OR, they're in the OR early, and then you get a chance to take care of those patients. Their length of stays are going to be shorter versus academic places. At least even with my medical school, they had the largest burn unit in South Florida, but burn patients are they're really sick patients, sick surgical patients. but they're in the ICU for 10, 14 days,
Right.
where you're helping taking care of them. And so the bulk of your time is really spent on this peri-procedural management and not necessarily surgical skills. So I think it's a huge variety, huge variation. And you kind of do need to do your research, especially if you're trying to like super optimize where you're going. Like I said, for me, it was a very simple decision of family's there. It's like, I'm going there. So
surprisingly, in my transitional year, one of the things that attracted to me, especially in that program, was the experience in interventional radiology. Even as a diagnostic radiology resident, we still working through IR. We are still expected to have some procedural skills and experience per ACGME requirements, even just to graduate, right? At my program, when I did my IR rotation, I did 30 thoracentesis, paracentesis, got very good at them, did a couple of ultrasound-guided liver biopsies. So it was a very varied experience. A good friend of mine who went into an integrated IR program, he also did an interventional cardiology rotation where he actually got to do right heart catheterizations.
Wow.
So skills that are very, very relevant. And he also got even a bigger experience in IR because he was pushing for it. So even in a community program, the skills he learned were directly useful or directly correlated to whatever he'll be doing as an interventional radiologist, right? And that was his kind of big draw to the program itself. So even at a kind of low acuity, low volume community transitional year program, your mileage may vary in terms of how much procedural experience you'll get. Now, for applicants, right, how should they fish out these waters? Like, how should they approach these questions? Should they ask this to faculty? Should they ask this to residents? Should they make a call the residents later after interviews to kind of ask these questions?
So I think it's tough. I think TY, like interviews are a little bit earlier on in the interview cycle, from my understanding. Surgical prelims are typically just the latter half, right? It's like, it's typically done by the same people who have their categorical program, and it's after they've interviewed all their categoricals, it's whoever else they want to do for a prelim spot. And so at that point, I think it's like, if you ask attendings, they're all going to say the same thing.
Right.
With motivated students, there's a lot of opportunity, right? Quote unquote.
Wow,
I think, talking to residents is the best way, both categorical and prelims at that institution, because they oftentimes could just have different experiences. Sometimes the prelims don't have representation in the general kind of like residency cohort, so they may get the poorer rotations and like the unfortunate kind of services that others don't want to be on, or just a lot more calls. So it's just talking to people.
Now, for IR, this is a deeper question. How necessary do you think a surgical intern year is? Is a surgical intern year a must for IR?
I don't know, right? Like I think it's one of those things that's tough to say 4 months out, right?
That's right.
And I've only had a month of IR. Right. In terms of like suturing skills, like it's not like you're gonna have to know how to do like 6 O's and like close of like a renal artery if you're doing a transplant. You're never gonna have that much detail. And then to what extent, like using just like fluorovicryl and then silk suture to like do drain stitches. We'll just pick that up after doing them for like a month, right?
That's right.
So I don't know. I really don't know. But I guess it's also a personal decision of how much do you want to round versus not round. And
that's right.
Like, at least for me, it was very easy to not like rounding.
You don't like rounding, that's
like
right.
The decisions to be made fast and we figure it out.
Yeah, I think old school attendings were on the camp of you need a surgical intern year for IR, but I think recently on Twitter I've seen many newer faculty saying, it's sort of not necessary. As you said, you're not putting in complicated sutures, and the skills you need, the catheter skills you need, really come from IR itself, the experience in IR itself. Now, if you did lots of vascular surgery rotations, or as I said, my friend was able to do an interventional cardiology rotation where they're pretty much playing with the same catheters, getting the same sort of access points. That could be directly useful, and you could pick up the skills that you will directly need for IR. But again, it's a give and take, right? As you said, just for IR, for diagnostic radiology, knowing these complex surgical patients, knowing the pathologists, knowing the surgeries, right? And what things should look like post-op is very, very useful and a skill that you'll definitely need coming into residency, and definitely increases the learning curve, as I'm finding out the hard way.
Yeah. Yeah, I mean, I think like medicine is so broad, radiology is so broad, and there's like, even if you do a gen surg year,
Right.
you don't get neurosurg, you don't get ortho experience.
That's right,
and
that's
like,
right.
I started off on MSK and I was like, I don't even, like, I know prosthesis and I know
Right.
nothing else, right?
That's
And
right, yeah,
there's
yeah.
so much variation between them.
Yeah. Now here's another thing, like, in terms of, we both made a decision based on our location. I wanted to kind of stay in the same area as my medical school, and you sort of wanted to stay home, right?
Yeah.
For folks who have a little bit more freedom, right? Do you think the advantage of coming to an institution, like coming to the institution where you're doing your radiology residency, outweighs the decision to kind of go elsewhere to maybe kind of get the same experience, whether it's prelim medicine or prelim surgery?
Yes and no.
Yeah.
You know, to what extent will you have the time in intern year if you're doing a medicine or surgery year
Yeah,
at
yeah.
that institution? I don't know.
Yeah.
And then in terms of like, knowing faculty outside of medicine or
Right.
outside of radiology,
Yeah.
once you're in the reading room, like you don't see anybody else,
That
right?
is
So
true,
like,
that's right.
I may quote unquote for IR when you come back to that world, like you'll know like the chiefs for other services where you're co-interns,
Yeah.
maybe.
Yeah.
But again, like it's so variable. People take research years like in all specialties.
Yeah.
So like who's going to be your co-chiefs at that time? Hard to say.
That's true,
right?
that's
And
right.
I think, and at least in the U.S., like at this point, there's only 2 or 3 main like EMRs, right? So like
Yeah.
from a workflow standpoint, we use the same EMR in med school, intern year, and residency, even though it's 3 different institutions.
Yeah.
So I don't think it really makes a big difference.
Yeah. And I agree with that sentiment. I think in radiology, it's sort of in its own world, and if you don't know, if you don't get to know the radiology faculty and intern year, you'll kind of get to know them soon afterwards. It doesn't make a huge difference. I think what can make a difference if you're sort of ambivalent is moving.
Yeah.
It's a huge hassle to move again.
Yes, it's a pain, yeah.
It is a pain to
Yeah.
move
Yeah.
twice. I think a lot of us, especially even in diagnostic residency, we were thinking about fellowship. A lot of us are thinking about just staying here instead of moving for a year. Right? It is a hassle, and that's something that could be avoided if you do your prelim year here, especially if you're thinking about the same sort of experience, whether it's university prelim medicine versus another university prelim medicine, whether it's university surgical prelim versus university surgical prelim, right?
Yeah, 100%. I mean, kind of made it easy for me.
Yeah.
Like, I moved from Miami back home. I already had all my clothes, so I just came in my car. And then I moved, and Philly, my fiance, was already here. So
wow.
Showed up, and it was not as hard as, definitely, I think, like finding a new place and figuring all that stuff out.
So, let's build on that a little bit. If you could go back and do your intern year, would you have done your intern year in the same institution?
Ideally, yes, but I did not get an interview. Like, that was kind of the crux of it.
Right.
And I didn't know that kind of prospectively, right? Because like surgical prelim programs, they're not the most competitive.
Yeah.
And so like I didn't apply to like the 50 IR programs. Like I didn't apply to one at each of them. So really the only decision for me was really, do I stay at my home, like medical school intern year, or go home to Tampa?
Right.
And so Tampa for sure, because like I always tell people, like there's no point living outside of home during intern year, because all you do is you eat, sleep, and you rinse and repeat.
Yeah,
So,
that's true. For me, right, I have a deep appreciation of all my colleagues and all of my attendings back in Syracuse. But one thing that really, I got very homesick. I think it was difficult, at least for like 4.5 hour drive to come back to New York every now and then. Even with all the free time I had, there was always some weekend call or something like that coming up. And so, part of me, I wish if I could go back and redo my intern year, I wish I did it in New York. Now, not in one of those malignant programs, but then again, I think the location should have definitely, I found that location played a huge role looking back. And I wish I did that. I think that's something that all applicants should take into account, how location, it really becomes your number one sort of factor for deciding your intern year. And location, not just in terms of staying close to home, which ended up being for you, which ended up being important for me down the road when I thought about it. But in location, in terms of, whether you want to go away to a city that you've never experienced, whether you want to be in a different coast, for example, right? It ends up being the more important factor. It's the other experiences that you gather in your intern year that ends up being just as important as your clinical experience and the clinical learning.
Yeah, 100%. I think the toughest part is doing 30-hour shifts.
That's right.
Coming home, you sleep, and you wake up, and it's tough to coordinate to hang out with people.
Yeah,
right?
yeah.
And then at least being at home, what was nice was parents are at different life stages than you, right?
Yeah.
So they're not as busy. They've got more time,
right.
And they're available. And it's you already live at home. It's not any kind of distance.
Yeah.
So you got to say hi, hang out with them. And at least for me, it was the first time moving back home in 10 years. And again, not I'm living there now. So it's kind of a little kind of bridge in between all these different parts of my life.
And you save money too. I think it cannot be, the importance of it cannot be overstated. Rent is expensive.
Yeah.
Even if you're spending $1,000 on rent every month, there's food, there's all these other expenses, which again, if you can avoid it, definitely do.
Yeah.
All that money just goes straight into your pocket, probably towards your student loans, let's be honest. But yeah, man, anything else? Any other recommendations you'll give to our applicants who are about to start ranking?
Start ranking.
Yeah.
Intern year is tough.
Yeah.
I think, at least for me, up until around this time and a little bit later, probably closer to Thanksgiving, it was the worst. And everything was new and it was a really big struggle.
Yeah.
But like I said, at some point, there's only so much intern responsibility that you can get. And once you've mastered that, then it just becomes like any other job. It's a very tiring job. You can still do 30-hour shifts.
Right.
But I think you can kind of get better at how do I plan my energy, my time, and then at least if you're doing radiology, it's 1 year, right?
That's
so
right.
Everyone in my program knew my 100-day countdown of when I was leaving, and saying you're never coming back really. But at least you can. There's light in the end of the tunnel of going and starting the residency of the stuff that you ultimately want to be doing, and then we'll be practicing for the next couple of years of your life.
I think that is a very important message. Regardless of what type of intern year you do, at the end of your radiology residency, depending on the amount of effort you put in, you're going to become a super competent resident, right? So at the end of the day, after your radiology residency, you're going to know everything, and whatever you learned during intern year will not make a difference at the end of residency. In the beginning, there will be a learning curve, right? That can be sort of facilitated, that can be sort of eased a little bit with your intern year experience. So, really consider what is important to you, what is important to your personal life and a professional life, rather than, am I gonna get these complex pathologies, these complex experience? Because it's the other stuff that I feel like you do, for you, it's hanging out with your family, having this little time. For me, it's kind of pushing my hobbies that truly made a difference. All right. Thank you guys so much for joining. Tune in next time for another good conversation with Azfar and Vedant.
On Clinically Correlate.
On Clinically Correlate.